Hi, good afternoon. I'm here reporting to you from a room we were able to find, a corner room at Bellevue Hospital with nobody in it. It's kind of a staff lounge. It's the only place that we can legally do something like this. First, I want to say hi to everybody. I hope you're safe. I hope you're remaining safe. We are being filmed by my partner here, Teresa. She's an anesthesiologist from Montana who came in to work. You can say hi to my patients, Teresa.
Okay. Hi. I don't know what I look like. Probably like hell.
It's fine. We're been here less than a week at Bellevue. Last time I was here was as a resident in the early 1990s. Some things haven't changed. This is the crown jewel of the public hospitals of New York Health and Hospitals Corporation. It's still a grim place. This is where the poor are taken care of. The majority of patients are minority patients with a lot of significant comorbidities, and this disease shows no mercy to anyone. Teresa and I visited the ICU, but we're actually based on this floor, which is a total COVID ward. We're doing things like blood draws and responding to respiratory arrests or codes and things like that. You guys know I'm a plastic surgeon. Teresa and most of the team are actually real anesthesiologists. It's rough. I mean, it's rough. It's very hard. Visited the ICU yesterday, which is totally crazy. You've got 110 patients on ventilators, 2 patients to each ICU room. The pumps that pump all the drugs are outside the room, so the nurses don't have to go in the room to adjust a pump. Each patient has their own ventilator, but they're 2 to a room, which is a very unusual situation. There are these teams you may have heard about, called proning teams. I'm going to actually hopefully join one of those teams, where it's sort of like an orchestrated group of setting up these patients who are connected to lots of lines of wires and, of course, breathing tubes, and flipping them over onto their stomachs, because it's been found that the lungs aerate better in many COVID patients when you're laying prone, meaning on your stomach, but it's an extremely hazardous move. These are patients who, can just die in a second, and unfortunately we witnessed that more than once this week. Very, very sad, heartbreaking. But there's a fraternity here of people caring and wanting to help. We're not at all alone. It's extremely fulfilling, satisfying, but emotionally taxing more than anything else, I would say. We're working 12-hour shifts, 7 to 7. One cool thing today, we heard the song by Journey, Don't Stop Believing Twice. That means 2 people were extubated, were taken off the ventilator, and it's the first time I heard, I had no idea what was going on, and then we learned why that is, and it's pretty cool. So there are things to be optimistic about, but I'll tell you, if any of you came in here and spent 20 minutes, you'd be exercising meticulous social distancing, and you'd be staying at home, because you should be scared shitless of this thing. This virus doesn't mess around, and there are people that are young that within hours crash and die. So be careful, be safe, and we'll get through this. And I look forward to seeing you in my office one of these days. Cuomo says maybe May 15th, God willing, inshallah, as they say. So that's all I have to say for now. Wish you all well. Take care. Peace.